So, you've been prescribed a combination inhaler for your asthma or COPD. You know it's important, but do you really get what's going on inside that little device? Well, that's exactly what we're going to do right now. We're going to break down the science behind fluticasone and salmeterol and turn all that medical jargon into something that just makes sense. All right, to really wrap our heads around this, let's use a simple analogy. Imagine a fire suddenly breaks out in the hallways of a building. You've got two massive problems happening at once. First, there's the fire itself. The smoke, the heat, that's the inflammation. And second, all the emergency exit doors are jammed shut. This is a perfect picture of what's happening in your lungs. The inflammation is the fire, and your tightened, constricted airways are those blocked exits. So to handle a crisis like that, you need a specialized team. And that's what your inhaler is. It's deploying two defenders to fight that fire and get those exits open. We're going to call them the fire extinguisher and the door opener. So let's meet this dynamic duo and see how they work together to tackle both problems. And here they are, our two defenders. On the left, you've got fluticasone. That's what's called an inhaled corticosteroid, or ICS for short. This is our fire extinguisher, and its whole job is to tackle that underlying inflammation. Then on the right, we have salmeterol. This one's a long-acting beta-2 agonist, or LABA. And you guessed it, this is our door opener, designed to get those airway muscles to relax and stay open. Okay, let's zoom in on the fire extinguisher first, fluticasone. See, this one isn't about a quick fix, not at all. It's all about playing the long game. Its mission is to control that chronic, smoldering inflammation that makes your airways so twitchy and swollen to begin with. So how on earth does it do that? Honestly, it's pretty incredible. It works at the genetic level. What happens is this medicine gets right inside the cells lining your airways, heads to the control center, and basically tells your genes to cool it, to stop making the stuff that causes inflammation. The end result? Less swelling, less mucus, and just overall calmer airways. And this brings us to probably the most important thing to understand about fluticasone. It is a controller medication. Think of it like building a firewall. It's a preventative measure. You have to use it every single day to keep that wall strong because it does absolutely nothing for a sudden flare-up. That's just not its job. Okay, so while the fluticasone is busy managing the fire, our second defender, salmeterol, is on door duty. It's a bronchodilator. It gets right in there and tells those tiny muscles that are squeezing your airway shut to just relax. It physically opens up the passageway so air can move more freely. And this isn't just a kick the door open for a minute kind of thing. Salmeterol is long-acting. Because of its unique shape, it has this long tail. It basically latches on right next to the muscle cell receptors and keeps them activated for at least 12 hours. That gives you that long-lasting, around-the-clock relief from that tightness. So, we've got the fire extinguisher and the door opener. It makes you wonder, why put them in the same inhaler? Is it just for convenience? Well, that's part of it for sure. But the real reason is that there's some serious synergy going on here. They actually work better together. Let's look at those benefits. Okay, first, the obvious one. It's just way easier to remember one inhaler instead of two, right? But here's the clinical genius of it. When salmeterol opens up the airways, it literally paves the way for the fluticasone to travel deeper into your lungs, getting that anti-inflammatory medicine exactly where it needs to go. So they're not just roommates in an inhaler, they're a team that makes each other stronger. So who is this powerful combo actually for? Well, it's officially approved for a couple of key situations. It's for people with asthma, whose symptoms aren't being controlled well enough with just a steroid inhaler, and it's for certain patients with COPD to help cut down on the number of flare-ups, or what doctors call exacerbations. All right, let's pause for a second. We need to shift gears and talk about something absolutely critical: safety. This medication is a game changer for many, but it's powerful and it demands respect. There are a few non-negotiable rules you have to know to use it safely. Okay, if you remember absolutely nothing else from this, please remember this. This is not a rescue inhaler. I'm going to say it one more time. This is not for a sudden asthma attack or when you suddenly can't breathe. It works way too slowly for that. Trying to use it as a rescue inhaler is useless and incredibly dangerous. Now, you might see something called a black box warning from the FDA on this, and that sounds scary. So let's break it down. Research found that using a long-acting drug like salmeterol by itself could increase the risk of severe asthma events. But, and this is a really big but, that risk drops way, way down when it's combined with a steroid like fluticasone, which is exactly how your medication is made. A couple of other serious things to keep on your radar.
For people with COPD, there can be a higher risk of pneumonia, so you need to be on the lookout for a fever or a change in your cough. And in very rare cases, the inhaler can do the exact opposite of what it's meant to. Your airways can actually clamp down tighter right after you use it. If that ever happens, you stop using it and get medical help right away.
Okay, so knowing the risks is half the battle. The other half? Using your inhaler perfectly every single time. This is how you get all the benefits while keeping those risks as low as possible. Good technique isn't just a suggestion, it's your daily mission. Now, your doctor or pharmacist is the best person to give you a hands-on demo, but the basic rhythm is always the same. You shake it well, breathe all the way out, and then as you start breathing in nice and slow, you press down on the canister. And here's the key part. You gotta hold that breath for about 10 seconds. That gives the medicine time to settle deep into your lungs before you slowly breathe out. And then after every single dose, you do this. No exceptions. Rinse your mouth out with water, swish it around really well, and then spit it out. Don't swallow it. This simple step washes away any steroid left in your mouth and is the #1 way you can prevent a pesky fungal infection called thrush. All right, like with pretty much any medicine, there's a list of potential side effects. The common ones are usually things you can manage, like a headache or a bit of a sore throat. But then there are the serious ones. These are the ones where you don't wait, you call your doctor. Things like chest pain, a funky heartbeat, or any changes to your vision. And last but not least, remember that none of your meds live on an island. It is so important that your doctor knows every single thing you're taking. Certain drugs, like some powerful antifungals or antivirals, can actually mess with how your body processes the fluticasone, which could increase your risk of side effects. So what's the big takeaway here? This inhaler is a cornerstone of your daily, long-term care. It's your maintenance crew. It's there to prevent the fire and keep the exits clear, day in and day out. It's not a quick fix. It's a serious therapy that works best when you are an active, well-informed partner in your own health. Look, when you understand how your fire extinguisher and your door opener work as a team, when you respect the safety rules, and when you nail the technique, you are in the driver's seat. This is your tool for taking back control day after day. The only question left is, are you ready to make it a core part of your defense?